BBC News.
Coming up here on NewsHour in a few minutes, we'll be asking a member of the Syrian opposition about access to chemical weapon stores alleged to be in rebel-held areas of the country. But first, we take a look at the economics of Obamacare, President Obama's healthcare programme, which, amid huge controversy, as we've been hearing, comes into effect today in the US. We thought we'd see how the system compares with the health system elsewhere. Our Berlin correspondent Steve Evans lived in the United States for many years. He's been comparing his experiences with healthcare in Germany and the US.
Everybody in Germany is entitled to affordable health care. It's got the oldest system of health insurance in the world, set up under the health insurance law of 1883. And under that law, there are official insurance funds to cover people against sickness. These funds are financed by contributions from the government, i.e. the taxpayer, from employers and from individuals, people, depending on someone's income. The poor don't pay. At the moment, people in jobs pay in just over 15% of their income. So in effect, it's a tax which goes straight to health insurance. Nobody can be barred from participating, say because they've got a pre-existing condition. If you're sick, you get treatment. I've been to the doctor quite a lot in Germany, just age, you know, and I've always found it pretty good. He tells me he works very long hours. He has got a nice sense of humour, I think. I had a blood test last week and closed my eyes like a child when the needle went in. When he pulled the needle out, my eyes still closed, he said to me he could also open his eyes now, and we laughed. When I lived in the US, I had insurance provided by my employer, so I could go to the doctor without hesitation whenever I needed to. It was a better appointed surgery in New York than the one in Berlin, less of a wait, more recently painted, nicer seats. But I have to say that I don't think the care was any better. In fact, the doctor I went to, in a pretty fancy bit of Manhattan, failed to diagnose a dislocated knee. I was in a lot of pain, but she said it was probably just a strain and that pain would go away. It didn't, until one day I clicked my knee around and all the bones fell back into place. I did have a friend in New York who kept getting pains. She was a freelance journalist, so she didn't have any health insurance. Every time she got the pains, she would say she really needed to get some tests done, but would then put them off because she didn't have the money. Debbie is now dead. The pains were the early symptoms of cancer. In Germany, a lack of money wouldn't have prevented her from getting basic tests done.
That was our Berlin correspondent Steve Evans comparing Germany's healthcare system with the new healthcare programme in the US called Obamacare. It's good to know, isn't it, that he feels comfortable sharing his health history with the entire world. Steve Evans there.